Hello class, I'm Hee-chan Yang. Today I'm gonna tell you guys about splenectomy and myofunctional therapy. Before I start my presentation, let me tell you the concept of my presentation. There is a patient in our dentist office who visited for a regular checkup. I looked inside the mouth for examination, and then I saw that the patient's lower front teeth gum had been much receded. The reason was that the labial frenum was attached too close to the teeth. So this patient needs a splenectomy. Now, I will give the patient detailed explanation about the treatment. Patient, when I look at your oral cavity, the problem that stands out is that your lower front teeth gums are receded. To solve this problem, you need to have a surgery named splenectomy. I know you are unfamiliar with splenectomy, so I'm going to give you more detail now. Before understanding splenectomy, you have to know what the frenum is. Have you ever heard of frenum? Our lips, cheeks, and tongues are connected to the gums by oral tissue called frenum. Frenum is a muscular attachment which connects lips and gums, or tongues and gums. Frenum sometimes secures and sometimes restricts the motion of mobile organ in the body. There is no problem if the frenum is properly attached to the normal position. But sometimes the frenum extends up close to the teeth. If the frenum is attached in an abnormal way, it can cause a number of problems. In this case, the frenum must be removed, and these treatments are called splenectomy. So, splenectomy is a treatment that removes part of frenum to make it stay at normal position. Then, when do we need to have splenectomy? In kids, there are two cases which require splenectomy. First, if the frenum of an infant is too long, it can interfere with lactation. It is necessary to cut a little frenum through surgery at this time. Second, when a child starts learning to speak, a frenum that is too close to the tongue can cause problems with pronunciation. Splenectomy is necessary treatment for adults as well as children. So now, let's find out some cases in adults. There are 3 cases in adults which require splenectomy. First, if the labial frenum is attached close to the teeth, space between the teeth can be created. In this case, not only splenectomy, but also orthodontic treatments should be performed. Second, the labial frenum, which is closely attached to the gums, can continuously pull the gums. It can cause gum recession, tooth decay, and gum disease. This is your case. The last case happens when you are wearing dentures. You may feel uncomfortable because the dentures get caught in the frenum, which causing the dentures to shake during meals or conversation. You may fully understand what is splenectomy and when the patient needs splenectomy. So now, I will tell you the process of splenectomy. First, I will give you enough local anesthesia to the area with labial frenum. Local anesthesia means to numb your oral tissue. Later, I will get a consent form from you. You won't feel pain if you get local anesthesia. Second, I will cut off the labial frenum by using an electric knife. After this procedure, we can release your tight labial frenum. I'll be careful not to hurt surrounding the tissue. The final process is stitching the surgical site and blood clotting. I will sew the incision back on. Then the surgery is done. But after that, you have to bite down on the gauze pad for at least 2 hours in order to make the healing process work successfully. When the treatments are done, you may feel sore, especially when you eat and speak, but that will get better soon. After the treatments, there are some instructions that you must follow. First, you must swallow your saliva and blood. This will help your blood clot to remain on the surgical site. A dry socket may occur if you lose a blood clot. And please avoid food and beverages that are too hot or too spicy. If you eat such things, it can interfere with the healing system of the gums. You can brush and floss your teeth as normal, except for the surgical site. However, even after successful frenectomy, the labial frenum can grow back to its original position. In order to help the frenum around your lips and tongue maintain the right position, I am going to introduce you some exercises named myofunctional therapy. There are 3 kinds of exercises. The first exercise is the A, I, U, V exercise. Like its name, this is an exercise that makes A, I, U, V sound. During this procedure, the tongue moves a lot, which developing the function of the muscles around the tongue. The second exercise is tick exercise. Like its name, this exercise is also use its tongue to make ticking sound like this. Third exercise is to put your tongue on the roof of your mouth. This exercise helps to stabilize the posture of your tongue. The most important thing is to exercise consistently and properly. Only then can the effect be achieved. This time, I will introduce a device used in myofunctional therapy. The name of this device is pre-ortho. Wearing this device helps to improve muscle function around the mouth. It also helps with the transition from mouth breathing to nose breathing, and is available to young children because the device is soft and easy to wear. So today, I explained about frenectomy and myofunctional therapy. These are some URLs that I referred to it while preparing for my presentation. Originally, these contents were quite unfamiliar to me. However, as I prepared for this presentation, I was able to understand well by using our textbooks and various materials. Professor Lee, thank you for your effort I did my best. And see you next semester, sir. Thank you for listening.